Thank you for joining me for this episode. We're going to talk about some extreme pain, but not knowing it's there on the OI show. Welcome to the OI show. We're excited to be joined by Robert Dempsey, a friend of mine who we've been friends for just over 10 years. We have the 10-year celebration of Zydra being on the market, and Bob was with Shire, and I got to know him in the pre-launch of Zydra. And he then left my sphere of influence for a while, and now he's back in the anterior segment space. Bob, it is awesome to get to hang out with you, my friend.
Oh, thank you, David. Really excited to be back in the front of the eye. Obviously, you were and your team was extremely instrumental in the success that we had way back in the day, 2016, when we launched Zydra, and the receptivity by the optometric community was second to none, and really helped drive the success of that program.
Well, you reset the stage for how to launch a drug because we hadn't had anything in a long time. So you paved the path, and we're excited to have you back. But you're in a space that is something we try to ignore because we have been unable to do anything about this. As you know, I have a referral-based dry eye clinic, and so we have this neuropathic conversation with our patients quite often. And we've had several episodes of the Optometric Insight Show dealing with how to deal with neuropathic pain. And it's just one of those things that keeps us scratching our heads. Why don't you lay the picture as you've come into this arena of neuropathic pain and neuropathic disease as to what we know and what we don't know, and how you are working to address that.
Well, first of all, thank you, David. It's very exciting to provide an update on Oakio. So I joined in January, and what attracted me was the opportunity to join a publicly traded company in which we were trying to address a very serious condition, and that being neuropathic corneal pain. And I'll kind of set the stage that at Oakio, our focus is on corneal and anterior segment diseases, and we believe we have a differentiated therapeutic approach to target this very, very underserved rare ocular disease. And we're pioneering a new therapeutic market with a novel, non-opioid, preservative-free eye drop with a dual mechanism of action from a standpoint of pain relieving as well as an anti-inflammatory. And we believe that this is a very unique approach to patients that have this very, very severe condition of neuropathic corneal pain. And it's something that, I am very passionate about. Having spent some time in the posterior segment and, dealing with AMD, DME, DR, those are sight-threatening conditions.
Hmm.
But this is the first time dealing with a life-threatening condition,
For sure.
and I say
Yeah.
that with a tremendous amount of seriousness,
Hmm.
because, getting to, do some research in this from, market research, patient journey, and, as you said, these patients are really debilitated. It's a severe condition, oftentimes, misdiagnosed, and by the time they see a specialist like you, they probably have bounced around to numerous other eye care professionals, and there's nothing indicated. And oftentimes we see these patients are really, really having a difficult time.
Yeah.
And unfortunately, in a small percentage of patient, they do, of dealing with a life-threatening condition because of the debilitating condition. And it's something that's very meaningful to me, having, spent some time, learning about the patient's experience and the need for a drug to treat these patients. Um,
Yeah, this is an interesting thing because one of the ways that we become a hero is the acknowledgement that we trust you. We believe what you're dealing with is really there. And you wouldn't believe, actually, you would probably believe because you've met so many of these patients, what just the realization of what you have is real.
yeah,
And I see it and I acknowledge it. And we'll do everything we can to hold your hand through this process. And you're right, but the diagnosis of it is becoming hopefully more and more as we bring awareness to it. And I know Oakio is doing a really great job of helping us bring awareness, is just such a key component of this.
Yeah, and I think medical education is gonna be absolutely critical. And working with physicians like yourself who are at the cutting edge of ocular surface disease, of dry eye disease, of neuropathic corneal pain will help spread the word to your colleagues. And we'll do that through sponsoring of CME, through educational events that we've worked with in the past, and obviously educational formats such as your podcast, David.
Yeah. So, Bob, why don't you tell us a little bit about what you've observed? Because you've done more market research on this disease than anybody. Um, what is some of the hesitation or the inability in the diagnosis, first of all?
I think it's a great point. So first and foremost, one of the things we found out in the patient journey is that patients jump around from physician to physician, whether
Hmm.
it's optometrist, ophthalmologist, in some cases, a general practice a physician, because it's so difficult to recognize. And part of it is that there's no clear diagnostic approach. There is one that is gaining popularity, and that's the use of the confocal microscope to
Yep,
identify dendritic cells, to identify microneuromas. But David, the challenge is only a very, very small percentage of patients, excuse me, of physicians have this equipment.
very expensive. Yep, yep,
And then there's the proparacaine challenge, which
yep.
is gaining momentum to help identify
Hmm.
these patients. We feel that is very important. So, looking at the patient journey, one of the things that's going to be critical is putting together an educational program. I look at the success of neurotrophic keratitis. 10 years ago, it was and is still a rare disease, but very, very few diagnostic ability of physicians to identify these patients. Well, I see
Right.
that as a very similar parallel in which we don't even have an ITC-10 code to diagnose these patients. So first
Mhm.
and foremost, it's understanding the patient journey, helping provide physicians the resources to diagnose these patients, and last but not least, start talking about what are the treatment options for these patients. And that's where
Yeah.
you and your colleagues will become critical in the future.
Yeah. So just because we're clinically based, I want to bring up an awareness of a simple test that we can do is the proparacaine challenge, which Bob mentioned. Is that's where we gauge the patient's pain before we do anything. And then when we put proparacaine in, we would anticipate that if everything is centralized and local to just the eye, that nearly all of that pain would go away. And what we find is that a large percentage is still remaining. And what oftentimes is we diagnose these patients with dry eye, and it's the pain with no stain.
Exactly.
And so we're treating their dry eye, and maybe we can get 10, 20, 30% better. But the proparacaine challenge really gauges for us if we treat with dry eye, how much do we hope to get better? And then there are some existing treatments, which we've talked about in other podcasts, to do for neuropathic corneal pain, but that gauges for you how much of this is really kind of, and again, it's an estimate. It's not a great test, right? It's not very objective. It's very subjective, but I just want to bring that up. So, Bob, tell us a little bit about what you're working on and what are some of the hopes that we have for this. Of course, there's a time frame that we're anticipating. It's not going to be this summer, uh,
Yeah.
but kind of give us some landmarks of where you're at and what you're working on.
And thank you again for the opportunity. So, first and foremost, the program we're working on has a unique mode of action. It targets the CHEM-R23 receptor, which is a differentiated mechanism that modulates both pain from neuropathic corneal pain as well
Uh-huh.
as immune mediated inflammation. So that's the hallmark of the drug. Now, why are we so excited? Is that we conducted a proof of concept study at Tufts Medical Center in Boston, in which we demonstrated a clinically meaningful reduction in the pain scores. That translated on a scale of 0 to 10, 10 being excruciating pain, 0
Yep.
being no pain at all, the patients experience a 5.5 point improvement on that 10-point VAS score.
That's huge.
And it correlated to 75% of the patients, David, having a greater than 80% reduction in their pain.
Mm,
But the good
That's
news
huge.
doesn't stop there. We also saw an effect on nerve fiber length in growth that was evaluated through the confocal microscope and an improvement in patients' quality of life.
Mm.
So, based on that data, we now are in the process of developing a clinical development program to go to a larger study in which we are in the process of a meeting with the FDA to talk about what that particular study would look like.
Sure.
If we're fortunate, we want to run a large scale study, multi center, multi country, and really do a deep evaluation of the effect of this drug in a large scale population.
Now, Bob, do you think like dry eye studies? This is years and years and years and years. Do you think this is going to be something that is going to be a really long term study because it has a shorter duration or shorter
Yeah,
course
David,
of duration?
yeah, that's a great question about the duration. We believe, or our proposal to the agency is a 3-month study.
Hmm.
And the reason why we're proposing a 3-month study is after 1 month of treatment in our proof of concept study, we saw a significant reduction in the patient's pain score, and we're able to maintain that for the following 2 months. So
Sure.
we believe in the totality of if we can have approval by the agency for between 100 and 150 subjects dosed on our drug compared to placebo for 3 months, that we can show a statistical significant reduction in pain when compared to placebo. And if
Hmm.
we're able to do that, we believe potentially that could be the basis of approval in which we would submit that information to the agency. And if we hit a high statistical probability, then that could show us and the agency that we have a drug that can affect a very, very sick patient population, and hence we would ask for expedited approval based on the
Yeah.
results of that study.
Sure, and we sometimes can get those expedited approvals because of the severity, and
Exactly.
this is one of those things in eye care, which fortunately we don't see very often, but does have life threatening significance.
Yeah,
Very, very exciting, very interesting.
yeah.
What should we be looking for from you in the coming year or year and a half? I presume you're going to help us understand neuropathic corneal pain at a greater degree. You already spoke to that. What should
Yeah.
we be looking for?
Well, first and foremost, we have to get alignment with the FDA and advance our clinical development program. Once we have that, our plan is to activate the clinical study with sites both in the US as well as Europe. Our goal would to be fully enrolled this study as soon as we can and potentially have top line data from the result of the study in the second half of 2027. In the event
Oh,
that
that's fast.
yes,
I,
yes,
I'm rooting for you. That's
yes,
good. Yeah,
yes. And if we hit that and it's positive, then we have to ramp up the educational component.
sure.
So
Yeah.
our goal with positive data would be raise more money and
Hmm.
then kick off our development in which we would submit to the FDA for approval, while at the same time ramping up the medical education. So working with experts like yourself to help increase the awareness, working with patient advocacy groups so that they know there's a new drug coming, and helping train physicians to better identify, diagnose, and ultimately treat. Because it's sad, David. One of the things I learned about the treatment options is we're giving these patients systemic medications,
Yeah.
opioids and gabapentin, because there's nothing topical for the most part that will, significantly alleviate these patients' discomfort and pain.
Yeah, and as you know, and as many of us in the eye care space know, is when we are prescribing for our patients. Um, it's not relief as your studies have, your early studies have shown in
Yeah.
any way, shape, or form. Um, we're still managing them. They're doing better, but they're certainly still needing help. Bob, in closing, what would you say? What's one thing you wish eye care providers better understood about their patients with neuropathic corneal pain?
I think it's a differential diagnosis. Oftentimes, these patients come in, as you mentioned, pain without stain. It could be the result of LASIK, could be the result of severe dry eye, of Sjogren's. My goal, my hope, my objective is to work with physicians like yourself to better identify so that there's not a wrong diagnosis, that the patients will be better diagnosed and therefore better treated. But
Mhm.
to do that and to do it successfully, we're going to have to help support the medical education arm to help get the word out there.
Yeah, yeah, very cool. Anything in closing here that you think we should have asked or should know?
Well, the last thing I would say is I think our focus on anterior segment and corneal diseases, I believe that with neuropathic corneal pain, it's just the first disease that we want to address. I
Yeah,
look at opportunities with this platform that we have to treat graft versus host
sure.
disease, which
Yeah.
is a very detrimental, potentially even neurotrophic keratitis with another
Mhm.
option for patients.
Hmm.
So any pain related impact on the cornea that has an inflammatory component as well, we're going to look at all these opportunities to treat. So neuropathic corneal pain might be our first, but I assure you, David, it will not be our
Not
last.
the last.
Yeah,
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 very cool.
yeah.
Well, thank you, Bob. I really appreciate you coming on the podcast, sharing some exciting news for us. We've had several guests talking about neuropathic corneal pain over the last couple of years, and I'll link those podcasts in the description below when we link the podcast. So if you want to check those out, but we're excited for what Oakio is doing, and we're glad to see you at the helm. So thanks for joining me on the podcast, buddy.
I appreciate it. Thank you for the opportunity.
Thank you for joining us. Make sure to like and subscribe. Stay tuned next time for more great insight from Optometric Insights.